Today we will discuss ulcerative colitis, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Ulcerative colitis is a chronic condition that causes inflammation and sores, ulcers, in the lining of the large intestine, colon, and rectum. It's part of a group of diseases known as inflammatory bowel disease, IBD. Common signs that you might have ulcerative colitis include abdominal pain and cramping, often accompanied by discomfort. Diarrhea. This may be frequent and can sometimes be bloody. Urgency to have a bowel movement. A strong need to go to the bathroom quickly. Weight loss. This can occur if you're not able to eat properly or absorb nutrients. Fatigue, feeling unusually tired or weak. Fever, sometimes a low-grade fever may occur. How to know if you have it. If you experience these symptoms, it's important to see a healthcare provider. They may perform physical exams to check for signs of inflammation. Blood tests to look for anemia or signs of inflammation. Stool tests to rule out infections. Colonoscopy, a procedure where a doctor examines your colon with a flexible camera. Getting a proper diagnosis is essential for managing the condition effectively. If someone has ulcerative colitis, here are some simplified steps to manage it. 1. See a doctor, get a proper diagnosis and treatment plan. 2. Follow treatment. Take any prescribed medications regularly. 3. Eat a balanced diet. Focus on easily digestible foods. Avoid spicy, fatty, or high-fiber foods that can irritate the gut. 4. Stay hydrated. Drink plenty of water, especially if experiencing diarrhea. 5. Manage stress. Practice relaxation techniques like deep breathing or yoga. 6. Keep a symptom diary. Note when symptoms occur and what you eat to identify triggers. 7. Regular checkups. Visit your doctor for ongoing monitoring and adjust treatment as needed. 8. Join support groups. Connecting with others can provide emotional support and helpful tips. In the hospital, if someone with ulcerative colitis needs help, doctors typically do the following. 1. Assess the condition. Check vital signs and symptoms to understand the severity. 2. For fluids. Provide fluids through an IV to prevent dehydration, especially if the patient has diarrhea. 3. Medications. Administer medications to reduce inflammation and manage symptoms, such as steroids or other drugs. Nutritional support. Offer special diets or nutrition through an IV if the patient can't eat normally. 5. Monitor. Keep a close watch on the patient's condition for any changes or complications. 6. Surgery, if needed. In severe cases, they might perform surgery to remove the colon. 7. Education. Teach the patient about managing the condition after leaving the hospital. Here are some commonly used medications for ulcerative colitis. 1. Aminosalicylates. Mesalamine acetol pentasa helps reduce inflammation in the colon. 2. Corticosteroids. Prednisone, used for short-term flare-ups to decrease inflammation. 3. Immunomodulators. Azathioprine, Imuran, helps suppress the immune system to reduce inflammation. Mercaptopurine, Purinthol, similar to azathioprine, used to maintain remission. Biologics. Infliximab Remicade, a monoclonal antibody that targets inflammation. Adalimumab, another biologic that helps manage symptoms. Janus kinase JAK inhibitors. Tafasitamab, an oral medication that reduces inflammation. Always consult a healthcare provider for the appropriate medication and treatment plan. People at an increased risk of developing ulcerative colitis include 1. Family history. If someone in your family has it, you may be more likely to get it. 2. Age. It often starts in younger adults, usually between 15 and 30 years old. 3. Ethnic background. It's more common in people of Jewish descent and those of Caucasian ancestry. 4. Living in certain areas. People living in urban areas or developed countries may have a higher risk. 5. Autoimmune conditions. If you have other autoimmune diseases, your risk might be higher. 6. Diet and lifestyle. Diets high in fat and low in fiber, as well as smoking, though smoking can have a complex relationship with ulcerative colitis, can also play a role. Being aware of these factors can help with early detection and management. Now, you need to watch my video on COPD or have a look at pneumonia.